It was very sad.
It really is.
Some of them were so young, 12 years old, 16. It's a good thing they had their mother with them because their mothers would have been just grief stricken.
Yeah. Yeah.
So now they could have gone, they went together.
It's a terrible tragedy. Just want to take a moment to just remember and reflect on life and to reflect on our situation as a family, and just reflect on the lives that have been lost, but the lives that we have today. I don't know about you all, but each time I have ever attended a funeral or lost a loved one, it brings mortality right in your forefront, and sometimes life flashes before your eyes. And we did just lay a loved one to rest. She was a friend of the family, and she was also a fellow nurse. And God rest Sandy Stevens' soul. And I would like to have a moment of silence for all of them, because if you're new to our show, you may not know, but we share the good, the bad, the happy, the sad. We laugh together, we cry together, and sometimes we have moments like this where we just need to have a little bit of time that we can just be together. So if that's okay with you, Doc, if we can just have silence before we get started, is that all right?
Very appropriate.
Okay, thank you. God bless us, everyone. Thank you all for participating in that, and thank you all for being with us on this show. We're looking forward to our guest tonight. We're looking forward to having Tracy back with us. And Dr. Tennant, we'll go ahead and just let you take it away.
We're all set?
There we go. All right.
Okay. All right.
All yours. Thank you, Doc.
Good. I know that the nation is quite concerned, and rightfully so, over this plane crash. It's such an unusual crash and involved a situation that's even hard to comprehend and involved a lot of young people, and it's a tragedy. And so it's hard to put that aside. I'd like to just give you an observation that has been very pleasing to me. Never in the last 20 years have I seen so many physicians, nurse practitioners, physical therapists, medical practitioners interested in trying to treat pain patients. Now, that might sound funny to you, given the problems we have in getting even a modicum of treatment for some people. But what I'm seeing is a new interest. I think the fact that we're starting to understand the underlying causes of pain is helping a great deal. But I'm seeing a lot of excellent pain clinics coming forward. Even my good friends, the anesthesiologists, are getting very interested in receptors and biochemicals. So I'm very pleased with how you might say, the pain treatment industry is evolving, it's changing. Granted, there's no big news about it, but I do think that a lot of great things are happening. What I'd like to start with tonight is a well-known fact. It's been around a long time, but we haven't taken it very serious, and that is pain itself is a biologic stressor. Now, that probably doesn't mean a lot to you, but what that means is this. Now, everybody knows what stress is. And those who study stress divide stress into common stress and biologic stress. Now, biologic stress means that something has happened to the biologic system to cause the hormonal endocrine system to kick in and fire up the immune system. Okay? In other words, you all know what that is because you've heard of something called fight or flight. And that means that when you get stressed or frightened, your adrenaline goes up, your cortisone goes up too, but your adrenaline goes up and your heart rate goes up and you get frightened and you start sweating, your eyes dilate, and we call that fight or flight. But what's happening is that the body got stressed real quickly and went into the biologic stress mode. Now, that mode can last 5 minutes if you're just running across the street to escape a car, or you're running away from a fight or something. But it can also be lasting several hours to days, or even weeks or months. And so biologic stress means that you are firing the endocrine system, the hormonal system. That means your cortisone, that means your testosterone, your estradiol, your pregnenolone, as well as some odd hormones you've never heard of like allopregnanolone or nandrolone, but that's not important. What is important for you to know is that pain itself is just like trauma, just like a severe infection, just like some psychological tribulation, just like some frightening event. Pain drives up initially the endocrine system. Your cortisol goes up, your adrenaline goes up, your testosterone, your estradiol, all your hormones flood the system, and it's mediated by the pituitary gland, as well as then it feeds into the adrenal gland and the pancreas and the thyroid and your other glands. Now, here's the problem. If you're overstressed too long, you can wear out those glands. And you'll have a lot of doctors now specialize in treating adrenal fatigue. And that's very appropriate because too much stress can wear these hormones out. Now, why am I bringing this up today? I'm bringing this up today because those of us who have researched this have known it exists, but we haven't had any great need to bring it into the clinical or educational purview of pain management. Now, let me segue for a moment. I've been a great believer, as you know, in pain management for everybody, for two reasons. Main, humanitarian. I don't like to see people suffer. I don't believe people should suffer. I believe we have all kinds of botanicals and other drugs to keep people comfortable, and we should do that and give people a quality of life right up to the time they die. So that's the humanitarian spiritual side. But I've also been a great believer that you've got to treat pain because pain causes too many other complications, particularly cardiovascular. Drives up your pulse, drives up your blood pressure, constricts your coronary vessels, alters your glucose and your cholesterol. So I've been a great advocate of pain management, pain treatment for not just humanitarian reasons, but to reduce the complications of pain. Now, I'm now going to bring in the third pillar. My studies of the Epstein-Barr virus and its cousins, the cytomegalic virus, the herpes 6, and the Lyme and the mycoplasma and some of the other infections that are tied in with Epstein-Barr, have now brought me to another realization that I'm even got a third huge reason why pain has just got to be managed, and regardless of what it takes. Now, here's what I'm getting at. Studies are very clear on how the Epstein-Barr virus works. The Epstein-Barr virus invades most of us when we're an infant, before age 2. Comes in, gives us the sniffles. It may wait till later and give you infectious mononucleosis when you're a teenager or a young adult, but once you've had the initial entry into the body, it enters into your lymphocytes and your throat membranes and becomes a parasite. And the body has about 200 parasites, so don't let that term throw you. But it's a parasite, meaning it lives in our tissues and lives off of us in a harmless way until you're stressed. Until you're stressed. Now, what we've now found out is that the Epstein-Barr virus reactivates under stress conditions. Now, what are those stresses? Well, trauma is the big one. I mean, somebody can have an auto accident, have a concussion, have a delivery go bad, have a war injury when you're a teenager or a young adult, and you don't know it, but that virus just got activated. and you didn't even know about it. An infection. People have an infection, they catch a meningitis or a pneumonia or a sepsis, a pelvic infection, prostate infections, and those infections may activate the virus. And a poisoning. I mean, people can come in contact with some allergen. Somebody can give you a spinal tap and accidentally inject a bunch of stuff into your spinal fluid through an epidural or something like that. That's poisoning poisoning your system, and so poisoning will do it. And psychological trauma will do it also. Now, all of us have our own psychological and emotional difficulties through life. But we even have something now called PTSD, post-traumatic stress syndrome. It's for real. All of us may have, not all of us, fortunately, but a good number of us have had a serious psychological problem in our life. We've had a death in the family. We've just heard about a couple of things. Perhaps you've been in a war situation to where you've seen some tragedies. Perhaps you've had a terrible divorce or a bankruptcy or some kind of a traumatic thing to your mind. That too will activate the virus. But guess what? Pain itself will activate the virus. Now, here's the thing that I have now learned that I want to pass on to you. If you have the Epstein-Barr virus, and it's turning out that certainly adhesive arachnoiditis and probably most of your RSD cases that are coming to my review, pudendal neuropathies, small fiber neuropathies, a lot of your other intractable pain conditions, most of those look like they have some kind of parasitic virus underneath all of things, giving them an autoimmunity. Okay? An autoimmunity means that you've got something that's eating away and destroying your tissues, giving you inflammation, adhesions, scarring, nerve entrapment, nerve destruction, and severe pain. Now, here is what I have learned, and it's really kind of sad. And that is, here you've got this virus hanging around your body, and you may not even know about it. The trouble with the Epstein-Barr virus is it's insidious, it's silent. We call it subclinical. That's why with these viral activations, you can wake up one day with a cancer or a severe painful condition, and you didn't even know anything was wrong. That's one of the problems we have in dealing with this whole matter. And so people wake up one day with severe back pain, severe migraine, severe neck pain, a Hodgkin's disease, a tumor under the arm. In other words, you don't even know it's coming. And so that's one of the problems with Epstein-Barr or recurrent reactivation and autoimmunity. You don't know it's happening. But if that viral condition gives you pain, a severe pain condition, the pain itself then becomes a stress, starts lowering your cortisol, starts lowering your DHEA, your pregnenolone, your estradiol, and makes the virus even more active. It becomes a vicious cycle. Remember that. So what I'm getting at is that I've been an advocate for pain treatment because it's humanitarian. It reduces the complications of pain, particularly on the cardiovascular and on the cholesterol system. But now I've realized that if you don't control pain, pain itself becomes kind of a vicious cycle. It makes the virus even more active, causing more pain. So you got to stop it. Okay, so what am I getting at? Dr. Ibsen certainly agrees with this, and so do I. Whatever it takes. Number one thing in a chronic painful condition is to stop the pain. Treating the underlying cause is secondary. Treating the complications is secondary, but you've got to stop that pain because you've got to stop the vicious cycle, particularly if you're someone walking around with high antibody levels of the Epstein-Barr virus. Okay? So you've got to stop that vicious cycle. Now, here is what I'm bringing it up tonight for a specific reason. All of you know we've got some tragedies out there. We've got some tapering, which is totally inhumane. We've got some people who pharmacists won't even give them their medicine. We've got some doctors who refuse to prescribe even an opioid anymore. So we've got these things in certain spots in the country. But let me tell you what else we have. And people like me we've really tried to be very reticent about having somebody having an implanted electrical stimulator or maybe an intrathecal opioid pump. We've said, God, let's try to hold that off as long as we can. Well, we still want to try everything else, but I want to make it very, very clear. If one has adhesive arachnoiditis, CRPS, pudendal neuropathy, small fiber neuropathies, any of your severe intractable pain conditions, and if you've got to have an electrical stimulator or an implanted opioid pump, you got to do it. You've got to break that cycle. Now, I also wanted to particularly bring something up. In the past, people, and some of the companies that make the intrathecal opioid devices have literally said you shouldn't implant it in somebody who has adhesive arachnoiditis. Well, I've gone along with that. Well, I've changed my mind. Why? I've reviewed over 1,500 MRIs of documented adhesive arachnoiditis cases. I can't validate a single case in which an implanted stimulator or an implanted intrathecal opioid pump either caused or made the adhesive arachnoiditis worse. Bottom line is risk benefit. The benefits of those stimulators and intrathecal devices may outweigh the risks. So I want everybody to know, including the companies that make the devices, if somebody makes some money on it, that's fine. I just want to see you break the vicious cycle of that pain, whatever it takes. Okay, one other announcement that I'm extremely excited about. Years ago, if you'll look at my own writings back, say 10 years ago, I was probably the nation's #1 advocate for the use of human chorionic gonadotrophin with intractable pain. And like a lot of good things, it became impossible for compounding pharmacists to get the powder, the supplies dried up. But what I'm here to tell you, and you're going to hear about it from our guest, maybe even a little bit, I hope, is that human chorionic gonadotrophin is now available to compounding pharmacies that they can make it at least in injectable form. Human chorionic gonadotrophin should become part of frontline treatment, in my opinion, for any intractable pain condition. Now, why is that and what is it? Human chorionic gonadotrophin is the good Lord's hormone in the body that the body uses to grow nerves. Human chorionic gonadotrophin it's also the pregnancy test. Now, why does human chorionic gonadotrophin go up in the urine and blood in pregnant women? Because the good Lord has it go up because that's what grows the embryo's brain and spinal cord and hair and nails. So it is the hormone in the human body that grows nerves. And it is now available again. I'm going to be talking and writing a lot more about it, but I did want to make you aware that as far as I'm concerned, if you have severe intractable pain and nerve damage, human chorionic gonadotrophin really has to be part of your treatment, in my opinion. It was the very best thing we had some 10 years ago, and I regretted when it went off. When it was not available, but it is now available again. I'd like to move on now. Jamie, are we set to have our guest come on, or
Yes, sir.
are we having technical problems here?
Yes, sir. We are having both, but we are set to have Tracy, and we'll go ahead and get started. Welcome. So
Hi.
good to see you again.
Good to be here.
Tracy, I can't see you where I'm at, but I hear you.
I'm here. Hi.
Again, oh, there you are. Hey, great. Well, welcome back. And I wanted to have you back for a good reason, and that is that you fought the wars with arachnoiditis and have not only stopped your deterioration, you've actually improved some.
Yeah.
And you're quite articulate, and you've worked very hard, tried a lot of things. You've got a little health background,
Mm-hmm.
and you're an inspiration to people.
I have fought tooth and nail this thing, let me tell
There
you.
you go. We'll take them both. And so I know Dr. Ibsen's going to have questions for you, and I've got questions for you.
Sure.
Let me start at the beginning. As I recall now, you're about middle age,
49.
49. How old were you when you first became ill? Meaning you knew you had pain or disease of some kind?
Are we talking arachnoiditis?
What? No, whatever. I want to know, when did you get sick?
Okay.
Arachnoiditis probably came later. You probably got sick before that.
Yep.
Yeah,
So
that's what I want to know about.
in 2011, I was diagnosed with Lyme disease and many co-infections.
In 2000, how old were you then?
Like 10 years, late, maybe early 30s, maybe.
And were you well up until you had Lyme disease?
Yeah, I was pretty well. Yeah, I was pretty well. I had mono when I was 16, but other than that, I was fairly well. Active, gymnast, cheerleader, dancer. Yeah, I was fairly well.
Now, that's what I want to focus on here right now, okay? If you don't mind,
Sure.
because I'm having a little problem trying to explain to people how you get in this mess, okay? Now, you were doing well
Yes.
until you had that risk factor, that
Yes.
stressful event called Lyme disease.
Yes.
Okay, that's a darn good way to activate a lot of viruses through Lyme. Okay, so you were about 31. Did you get over Lyme, or tell us about your Lyme disease?
It took me about 3 years. I actively fought Lyme for 3 years, and I was sick. Very, very, very sick with Lyme. I got down to 88 pounds. I thought I was going to die. I was so sick. But yeah, I came out of Lyme, but then I immediately got mold illness, which I had to fight as well after that couple of
That
years.
was mold?
Mold, yeah.
What kind of mold? Do you know any much about it?
Oh,
Was
oxytocin or something. My house, I had some water damage in my house, and then I became very ill from that.
did it get into your lungs?
It got everywhere. I was sicker than I was with Lyme.
So you developed a fungal infection. That's what mold is, some fungus. It's a fungus. Yeah. How sick were you with that?
Sicker than I was with Lyme.
Sicker than you were with Lyme.
Yes.
So you went between age 30 and so how old were you when you finally got over the Lyme and the mold?
Let's see, Lyme, 13, 14, 15, 16 was about 2016. I believe I developed the mold illness about 2017. I fought that for just over a year and a half.
Okay. Now, how did you tell us how you went from Lyme and mold to arachnoiditis?
Well, April of 2021, I developed COVID, and I was pretty sick with COVID. And September the 8th, I woke up and I had a severe backache, headache, neck ache, and I just knew I had meningitis. So I went to the emergency room, and lo and behold, I had a lumbar puncture and I had meningitis and COVID, and I was admitted. So
Okay.
when I had the lumbar puncture, and I've had many lumbar punctures, this one, there was something different about this one. This one just wasn't quite right. And I have had traumatic lumbar punctures, bloody lumbar punctures, you name it. I've had a ton of lumbar punctures. But this one, as soon as the needle came out, my legs were tingling and my legs felt very weak. Now, mind you, I'm very sick at this time, so I'm kind of, unsure what's going on. But that did get worse and worse and worse throughout my hospital stay.
And so how did you end up finding out you had arachnoiditis?
So while I was in the hospital, for a little bit, and I was noticing my back was hurting severely where I had this lumbar puncture. My head was just throbbing. I knew I had a leak at that point. My legs were weak. My legs were tingling. So I knew something wasn't right, right? So fast forward a little bit, I get out of the hospital and I'm deteriorating quickly. My feet are burning, my arms are burning, my hands are burning. I can hardly walk. I feel like there's a ton of bricks just hanging off on my spinal cord. So I'm Googling and Googling, and I kept coming across adhesive arachnoiditis. But I went back to the emergency room because I was in so much pain. I had an MRI that was just beautiful and perfectly clear. I knew they weren't seeing something. So I had heard about you. I took the MRI. I sent it to you. And it took quite some time, maybe 6-8 weeks to hear back from you, maybe even longer than that. But during this time, as I'm deteriorating very, very quickly and Googling, I keep coming across adhesive arachnoiditis. I'm like, doesn't sound like something I want to have. I really hope it's not that. So before I even got my diagnosis, I started the emergency protocol. I started HCG. I actually went and got stem cells. I went to Alabama and got a stem cell transplant. And so I'm doing all of this stuff before but I knew that I had it. And then lo and behold, I did get my MRI back and you said yes.
Stop right here for just one moment. It's very interesting that you knew you had it. Why did you think you had it? Can you think back your feelings, symptoms? Why did you think you have it? Because, people do this. I hear it all the time. They know when they get it.
Yeah. I had every symptom, every single symptom. Well, I went from being a very active adult to being, and I'm going to try to make it through it without crying, to being almost suicidal just within a matter of weeks. And my feet felt like were in meat grinders. My head is just throbbing. I had to lay down constantly. I couldn't sit up. It was 24/7 pain. I mean, from the top of my head to the soles of my feet. My back obviously being the worst, but I had never experienced pain like this before. And just Googling pain, lumbar puncture. And you start reading stories, you start hearing, but every single symptom I had that was adhesive arachnoiditis. And I knew it so much so that I did travel from Jacksonville, Florida to Alabama. I talked a doctor into giving me a stem cell transplant without even a diagnosis, spent $7,000 out of pocket. I was so sure that I had it. I found HCG, I found everything I could. I was so sure, but every single symptom I had, you don't just go from perfectly normal to suicidal with pain in that amount of time and not have something pretty serious.
Okay. What did you do, and when did you obviously hit a point to where something started working for you?
Yeah. So I think I was pretty fortunate that when I was in the hospital when I got the initial lumbar puncture, about every 4 to 6 hours, I was getting Toradol. So immediately that's a win. I didn't even know it was a win, but I was just getting, around the clock Toradol. So thank God for that. I did again your emergency protocol, which, the IV steroids I got in the beginning really, really, really helped. So at that point, I was pretty sure it was arachnoiditis, but I think and I started HCG immediately. I mean, we're talking within days of the lumbar puncture, I started the HCG. So I was hitting this at every single angle that you said to hit it with. And it was a combination. I just think of the emergency protocol, the HCG, the steroids, the Toradol, every single thing. And let me tell you another thing, Dr. Tennant. As bad as I was, I never stopped moving. I might only be able to get up and walk 5 or 6 steps, but I got up and I walked those 5 or 6 steps because I knew if I stopped moving, I was going to lose the ability to walk. I could feel it. I could feel myself losing the ability to walk. And I pushed myself and I pushed myself and I pushed myself to take as many steps as I possibly could. And it started off again with only 3 or 4 steps, but then it got to 5 and then it got to 6. and I just kept going. Now I stumbled a lot along the way, and I had a lot of flares, and I had a lot of falls, but I never stopped. And if one doctor said no, I found another one. And I mean, I've traveled to Tennessee, I've traveled to Alabama. I'm in Jacksonville to find doctors that would help me.
Have you been able to find somebody there in Jackson?
Yeah, I have a great doctor here in Jacksonville.
Oh, great. And did he know about arachnoiditis before you went to
No.
it?
She-
You
well,
educated him?
She did not know about arachnoiditis, no, but she was willing to listen to me. One, she saw me beforehand, and then she saw me immediately after and how bad off I was. And you probably don't remember, but she did call you. She immediately called you and she said, hey, what do I do? How can I help this girl?
Okay. Now, you've obviously, I know you work now. Now,
Yes,
somewhere along the line, you took your Epstein-Barr test,
yes.
and you're on an ongoing program now. When did you take your Epstein-Barr test?
That was about probably 2 years ago.
2 years ago. And do you remember what they said, what they showed?
I wish I would have printed them out, but everything was off the charts high. Every single thing.
Everything was there.
Yep. I got really ill again. I got really tired. And I said, I feel like I have mono. So I had my doctor run the tests and everything came back super high again. And we started me on valcyclovir.
And are you on a cyclovir now?
Yes.
Okay, you take a cyclovir now. How much of that do you do on a dosage?
I typically take 500 milligrams per day. And
Okay.
if I start to feel ill again, I will increase for a couple of days.
So you will feel it. Mhm.
Oh, yes.
Do you happen to know whether you said your tests were off the chart? Now, there are 3 tests that we'd like to have to find out where the virus is at, where you're at. 2 of them are antibody tests called, viral capsule antibody, and one's called nuclear antigen antibody.
Mm-hmm.
And then there's a third one called early antigen antibody. Do you know anything about which of the 3 you had? And I'm particularly interested in knowing about your early antigen.
The early antigen did show positive. I'm trying to find them as we speak. I may or may not be able to find them. But yeah, the early antigen did come back positive.
Did they ever do what's called a PCR test?
That I'm not sure.
Well, you don't need to. You need to, in order to know if you have a positive early, that's where the acyclovir and the valcyclovir comes in. Yeah, because that means the virus is active. So.
Yep, I do remember I did send them all to you, and you were so impressed with how high they all were. You sent a letter to my doctor saying, "Wow, this girl her EBV has reactivated."
Right. Well, what else are you doing to suppress the virus at this point?
Well, I stay active. I exercise, which is super important. I meditate. I get plenty of fresh sunshine, and I eat a pristine diet. Anything anti-inflammatory I can get in my body, I eat. Anything inflammatory, I do not eat.
Right. Now, what about, have you found any supplements? I'm interested in knowing what you're doing for pain at this time, as well as what you're doing for dietary supplements.
Okay. So for my supplements, I do take NAC 600 milligrams per day, serapeptase 1,000 milligrams per day, quercetin, PEA, turmeric, collagen, high doses of vitamin C, iron. I take Toradol once a month, and then I take my HCG. I take peptides. I'm currently taking one called, I can't even pronounce it, pentadecpeptide.
Okay, no problem. Yeah.
Yeah, and so I'm taking that one. So yeah, I take my peptides, I take my HCG, and the PEA, turmeric, I take something called chronic. I take something called acute. They're just anti-inflammatory stuff.
Mhm.
Multivitamin and yeah, that's about it. I do rotate my peptides out though. Sometimes ARA, sometimes BPC, KPV.
Okay. Are what are you doing for pain? Or in fact, how is your pain now at this time?
My pain is pretty okay. I don't have a whole lot of pain at this very second. I can honestly say that I don't have any pain right at this very second. Now if I sit in this one spot long enough, I'll get some pain. You know, I do have to kind of twist around a little bit, but the Toradol once a month, if I have a flare, I'll go on some steroids, but other than that, I'm really not on any pain medication. I just keep the inflammation as down as I can.
At one time, did you have to take some of the opioids at one
Oh,
time?
yeah, yes, yeah.
Which
I
ones
would,
did you take?
well, let me tell you, I was in bed, bedbound, I would say 23 hours a day for about the first year of this, even after the stem cells, it took a while for them to kick in. Morphine, meloxicam, there's one that starts with a T. I can't remember, gabapentin. I'm sure the same stuff most everybody to Tendamax. I don't remember all the names of everything. I took what they gave me. But I thank God I never had a really hard time getting pain medication. It was actually harder to get the Toradol and the steroids than it was pain medication.
Yeah, I'm not surprised about that. Yeah. Oh, could we go back for a moment to the Toradol?
Yes,
Okay. How much do you take? You take it once a month?
I take it once a month. I think it's 60 milligrams.
60?
I think it's 60.
Is that an injection or tablets?
It's an injection
You
in my
take
hip
60 milligrams once a month.
once a month,
Okay.
yes.
Do you feel much after you take it now?
No, but I'm afraid if I stopped taking it, that I would.
I would be too. Yes. Uh-huh. And how much HCG do you take?
I believe it was 0.25. It was whatever you told me to take. I think it's 250, 250.
Uh, how many times? Once a week? Twice a week?
No, I typically do that 2 or 3 times per week. I rotate that out with the pentaseplatide.
Okay. Is that the BPC peptide you take?
It says pentaseplatide 5 milligrams BPC arginate.
Yes, BPC 157. Uh-huh. Okay, right. Well, I wish I could duplicate you. I mean, what you've done is really outstanding. But let me ask you this. I take it the mere fact you say you've got to keep taking the Toradol, you feel that if you didn't, what would happen to you?
I feel like I would deteriorate.
Yes. Hmm. Right. I think you would, actually.
I do.
Do you know what your viral tests are at this time?
My viral tests, I'm not sure.
Your Epstein-Barr viral test. Your
No, I haven't taken them in 2 years. Everything was pretty high about 2 years ago when I took them, but I haven't taken them recently. No, sir.
Well, if you do, let me know. I'd like to.
Yeah,
I
sure.
guess-
I could. I work in internal medicine. I could take them anytime. But you know, I do want to know, as well as I'm doing, I'm definitely not who I used to be before this happened. Like, you know, I can't do a cartwheel. I can't do a back bend. I can't get up off the toilet like I used to, or get up out of the bathtub like I used to. I have adhesions that are ripping constantly, and I have some pain. I'm not who I used to be, but thank God I'm not where I was, but I never stopped. I never stopped moving. I never stopped trying. I never stopped trying to find a doctor that would help me. And I went anywhere that I could find somebody that would even listen to me, that would help me.
Let me give you what you're telling me. I believe everything you're saying because it makes good sense. A bit of education here for all of us. And that is, at this point in time, Rheumatoid arthritis is not considered curable. Systemic lupus is not considered curable.
Yeah.
Those two diseases. They may both be tied to Epstein-Barr virus, at least partially, but and multiple sclerosis, same way. They're very closely related to adhesive arachnoiditis. Adhesive arachnoiditis is fundamentally, we now know, an autoimmune inflammatory disease, just like rheumatoid arthritis. And so we can control it and suppress it, but I don't know that we have a cure.
Sure.
There is something about this autoimmunity that's induced by these parasites that we can't get rid of in the body yet. Okay, a lot of the biologics and things are really working. For example, I'm now starting to recommend that people take methotrexate, and so we are making some slow headway. How do you feel about it personally, that you now are stuck with the disease for your life? I mean, you probably just said it that you've.
It's so aggravating. It's so aggravating. It's very upsetting.
Yes. How have you dealt with your family and your job, the people around you with this condition?
I am so fortunate. I have the most understanding husband that was ever put on this planet. With he would drop anything to go to Atlanta to help me, or to go to Tennessee, and he's been with to everywhere. My job has been amazing. Every single person has been absolutely amazing with this, other than a couple of doctors that I've run across, but people that know me personally. But they also see me, hey, she's trying, she's getting up, look at her. Like, she walked halfway down our driveway and back. So they see me. It's not like me to lay around and do nothing. So when I do, it's a big deal. But I'm very fortunate that I have great people around me.
Great people around. Now, do you have children?
I have 3 grown children.
3 grown children.
I have 6 grandchildren, yeah.
And how are they doing with you?
They're great. Other than the little ones can't really understand why I can't pick them up, you know? But obviously, I can't because of my back. But other than that, it's I can't play with them like I used to. But yeah, they're pretty understanding. Just they don't understand why grandma can't pick them up.
Yeah. Now, sounds to me like the angels were looking for you on a number of occasions.
Yep. Yes, they were. Yep. They were. God is
They
good.
They were
God is
hovering
good.
close by. Okay. Tell me about your spiritual beliefs, and I take it I've never asked you about this, but
I am
in your case,
I am a born again Christian, and I give all glory to God for every single thing that He has done for me. Why He chose me to get through all of these things, I don't know, and I won't know this side of heaven. But I give all glory to God for every single bit of healing that I've had.
Yep. Mark, are you there? I hope you're there to chime in here.
Yes, but I'm weeping.
I hear you. I'm with you, Betty. What do we say here at this point? Can we clone this young lady and do something with her?
Well, you raise an interesting point. You know how we first obtained gamma globulin in COVID patients, from sick COVID patients.
Yep.
And so maybe you've got some gamma globulin that could really work for some people. I don't know. I'd never thought about it till this second. But yeah, you're an inspiration, and what's really inspiring is your indefatigable, or your resilience and your refusal to lie down for this.
Yeah, I was too bad. I wasn't going to let it take me out.
Yeah,
Still
yeah.
won't.
And you're blessed. I mean, you've had miraculous results.
Yep.
Lots of us who are lying around because we haven't had those kind of results, and it's
Yeah.
no fault of ours
know,
who
I
haven't
know.
got better. It's
I know.
just it's a blessing in your case, but what's inspiring is it's possible.
Yep.
What's also noting is that a lot of us who have these illnesses, they've kind of had a perfect storm land on them, but you had a perfect umbrella and raincoat show up right at the beginning of your perfect storm. which did not allow this stuff to really get heavily established in you. And I think that's another key thing for us to take away is that there is an acute phase that's really worth engaging with in terms of initial symptoms for people. And that gives me hope in terms of um, this is not a life sentence. I mean, human existence is a sexually transmitted disease that's uniformly fatal.
Yeah, yeah,
So,
yeah.
we're in our second terminal illness, if it's that. But what I really want to acknowledge is that you didn't give up, and you've tried what works for you, and you are 100% Nobel Prize winning expert in your illness, and well done.
Yeah. Yep. Yes. And I can say anyway, don't give up. No matter how bad off you get, keep going, keep going, keep going. Find the next doctor to listen to you. Find somebody to listen to you.
Right. Just a couple of other last things, Tracy. I wanted to emphasize that your whole history is rather classic on how this developed. Okay. Now, you started off with Lyme disease. Now, whether your infectious mononucleosis made you at a higher risk for this is something we don't know. Now, there are reports going clear back into the 1980s to where some doctors traced people after infectious mono and thought that mono continued subclinical, you see. And then you got the Lyme disease, and so obviously that virus was starting to activate many years ago, right along with your mold and everything else, and what have you. So I want to make the point to people, before you get adhesive arachnoiditis, a whole lot of bad things have got to happen before that. You just don't wake up one day with that. You're going to have things, this trauma, this stress prior to that time. I want to make a point to that, and you illustrated it very well. The second thing that you do, we have a handful of things that really seem to work on this disease. Toradol is one of them.
Yep.
Methylprednisolone is another. HCG is another one. This BPC peptide is really turning out to be a very, very important. You've taken the best medicines we know. You've had your spirits. You've had your exercises. You've done it all very good. Plus that, we'd like to have you. You need to think in terms of trying to maybe put some of what's your life story or your journey into some kind of writing, and some kind of teaching. I'd encourage you to do that. Okay.
Yeah, absolutely.
Yeah, very good. So thank you very much, Tracy. I want to call Mark back on the show here for a couple of minutes. Again, God love you. I'm so glad you're with us.
I can't
Thank
wait
you
to
for all
read your
you
book,
do.
Tracy.
Yeah.
I want to read your book.
Absolutely.
Yeah.
Thank you, Dr. Tennant.
You betcha. Mark, I'd like to, you heard me earlier in the program today talk in terms of somehow we've got to make, when somebody develops severe pain, that's got to be the number one thing in clinical practice. Have you got any new insights, either politically, spiritually, medically, that we can move the needle at all?
I have been, I'll talk about self-care for a second. I have been failing in my own self-care. And I'm just coming out of a sort of a dark place. I went skiing today for the first time in weeks. And I can see that, the days are getting longer. Maybe that has something to do with it. The other thing that I have in terms of my self-care is, and I think most people go through this, is I've been wallowing in my own self-pity, and knowing it and doesn't make it necessarily go away. So helping others brings me out of that every time. And so for those of us, almost everybody on this call is an empath of one form or another. And I argue with it all the time with myself, but it's like there's something about helping others that helps me feel better, and it helps me It maybe distract me or helps me in my denial. I don't know what that is, but we all need strong levels of denial in order to keep going, and optimism and spiritual activities, whether it's structured or non-structured. And not only are those of us with rare illnesses expert in that illness, we've also become experts in the self-care of that illness. And so what I've learned from my colleagues on this call is that that I have the right to take care of myself, and I've been kind of hunkered down and worn down, and I think my adrenals would, might not be all that healthy. So I have my own challenges coming up, and I want you to know that I'm coming out of that dark spot. And I'll just tell you, I helped a patient die yesterday with prostatic cancer, and this is a wealthy man who had a last wish that I was able to participate in, and he begged me to be present for it, and it was like being at a natural birth or some other natural phenomenon, to minister to and listen for and reliably deliver that which what might make a difference for somebody at the end of their life. I saw the peace on this gentleman's face, and I saw the terror in his eyes when he asked me to help him. And we were looking out the window, and an eagle landed in the tree across from his big picture window. And I can just see that there are signs. Most of the signs that everybody on this call see are grim. It looks like there's a Dementor or a Grim Reaper at the door, and don't let him in.
Yeah. Well, let's see. Can you hear me okay?
I can.
Okay.
I just
Well,
stopped talking because I'm out of words.
Oh, that's out of words. Well, Mark, as you know, in our job, it's our job and our calling to be with the people who are at the end. And the Dr. Kubler-Ross was one of my great heroes. And there's nothing wrong with us doctors being there at the end, okay? Because it comes a lot sooner than any of us want, okay? So thanks for being there for the gentleman, whoever he was. At any rate, one last thing I want to do before we close out. I think you heard tonight from Tracy, and there's no better person to say that we can slow down deterioration. We can give people good quality of lives. We get criticized sometimes when we start talking about how conditions that are intractable pain are life-shortening. Okay, that's a great problem out here. But when you have, and I want to close this session out, there's something about pain that I want to pass on to people, and that is you can cut off pain, intermittent and constant. If somebody has constant pain, what that means is that there is some biologic tissue damage inside the body. This is not just psychological. And that we need to get people to really think in terms of, is my pain intermittent, comes and goes? Yeah, we got a lot of people with chronic pain and they deserve treatment too. Otherwise, they may switch over to become those intractable cases. But intractable constant pain continues to be an issue in this country and in this world that people don't want to address. Okay? They don't want to talk about it. And the reason they don't want to talk about it is understandable. It's sorrowful, it's tragic, it has been thought to be incurable, but I'd like to see that attitude change. We can give people a better life, we can extend that life, and I think that Tracy gave us a good thing. It's sad when somebody has a disease, you can't get rid of the darn thing. You got to carry it. Well, you got to carry it, but that's why we've got our angels and we've got our spiritual, we've got our friends and we've got our Facebooks, we've got our network. and we want to build that network. And I'm going to just close out by saying one thing. I am absolutely, nobody talks about it on the big media. Nobody's interested in government, and you're certainly the Congress isn't interested. Nobody, Hollywood isn't interested. But I'm going to tell you, I do believe down at the community, local level today in this country and in this world, I believe we're circling the wagons and starting to take care of each other, and that including those with intractable pain. Again, I want to thank everybody who's been on the show tonight. Tracy, start writing, start teaching. Jamie, keep sponsoring us, keep working with us. Mark, you take the worst cases. Keep it up. We got to have you, baby. And with that, I'll sign off tonight. We'll see you next week. Good night.
Thank you, Dr. Tennant. Thank you all. Thank you, Doc Talks family. You are not alone, and we will see you next week at the same time, same place. Thank you all so much.
Thank you, Jamie.
Thank you too. Good
Bye,
night.
y'all.
Night.
Bye.
Night, Dr. Ibsen.
Good night,
God bless us, everyone. Good night,
everyone.
everyone.
Yes.
Red, blue, short, tall, male, female, and those in between. All of us.
Loves us all.
Good night.
Good night.
Thank you. Wonderful show. Beautiful show.